We learned this week that 4 out of 5 African-American children in Wisconsin live in poverty, and now they face another challenge.
Michelle Fiore is here to explain. Michelle?
Mike and Carol, struggling families in Milwaukee have for years turned to the Black Health Coalition of Wisconsin for help. But tonight, the federal government has nearly pulled the plug on it.
Black babies are dying in our community. We need to care about that.
For 25 years, the Black Health Coalition of Wisconsin's been there for thousands of families, preventing infant deaths and low birth weights.
We get phone calls from just even recently, pregnant women in jail, 7 months pregnant. No doctor, no prenatal care.
But its Milwaukee Healthy Beginnings project must close as of January 31st because of the loss of 2 federal grants, taking its operating budget from $1.2 million to $200,000.
I don't want to forecast the doom and gloom of what it will mean, but we've been a lifeline, a last lifeline for the community in this regard. So to cut off that lifeline, it's troubling for our community.
Carolyn Gray's a new client.
Oh, I got bad knees, back, and a back problem and arm problem.
But she may be too late to benefit from what the coalition has been able to do in the past.
They help women talk about what goes on in their life and abusive life and stuff like that.
The Navigator grant was also denied. It pays for the training and employment of Affordable Care Act navigators. The coalition had 4.
So people were able to come to our office. We went out and had satellite locations throughout the community.
The next open enrollment starts November 15th, but those navigators had to be laid off today.
Being able to walk away from that is hard at this point.
We asked the Department of Health and Human Services why they denied the grant. A written response said, quote, each application was evaluated, discussed, and scored. Black Health Coalition of Wisconsin did not score high enough to be funded. Michelle Fiore, today's TMJ News. Mike and Carol.
All right, thanks, Michelle.